At Alleviation Ketamine, we provide intravenous ketamine infusions. And the reason that we use IV ketamine is for a number of reasons, as opposed to other forms of ketamine. So ketamine can be given intramuscularly as an injection. It can be given intranasally. And there are some derivative medications such as S-ketamine or Spravato, which are intranasal forms of a molecule related to ketamine. There is sublingual ketamine, which is administered as a lozenge or a tablet that dissolves on the tongue. And then finally, there are oral forms of ketamine, which have some unique places within ketamine treatment, but in general are uncommon. IV ketamine, first of all, has an abundance of scientific research. The majority of research on ketamine for depression, for chronic pain, for PTSD, for addiction, is in using IV ketamine. And so we have a lot of scientific evidence to back up that this works, is effective, and is safe. The other reason that IV ketamine is better is that it's absorbed 100%. So when we put in an IV and we infuse ketamine through your vein, we know exactly the dose you're getting. When you look at formulations such as sublingual ketamine or intranasal ketamine, your absorption can be anywhere from 20 to 40%, depending on multiple factors. If you have a cold, if your mouth is dry, if you're some people have medications that make it harder to absorb through the mucosa, and so you're not always clear on what dose you're really getting, and so that can lead to variable effects from one dose to the next, and that can sort of cause some problems with both safety and effectiveness. And then finally, with IV ketamine, we have the option to turn it off if you need to. So if you're having some kind of a side effect or if there's some problem, we can turn the ketamine off and it wears off really quickly. And we can also slow down the rate if we need to. We can speed up the rate and give additional ketamine depending on what your level of consciousness is. When you're getting it through an IM injection or you're getting it through a lozenge, all the ketamine dose goes in all at once. And so you don't have the flexibility that we have using the IV. And then lastly, when you have an IV in place, we're able to give you additional medications that can help enhance the process, that can help deal with side effects. And so overall, IV ketamine is more effective, it's safer, and it allows for us to tailor the experience to what you really need.